Many of us live in a rural area, and while most choose this life for the slower pace, access to health care can sometimes be a challenge. That's why Munson Medical Center is trying to make it easier for patients who are having a heart procedure both before and after surgery. Michelle Dunaway shows us how in today's MedWatch report.
Maria Stevens grew up in southern Germany and is no stranger to hardship.
As kids, we were sitting up there and watching the Russian tanks on the mountains and the American tanks on the south of us. Every day we were getting told that the Russians are moving closer down the mountain. And we were scared to death when they come, because there was lots of bad.
The strong, resilient woman made her way to Falmouth, where she found a life she loved.
Have everything right here. It's a nice community here. Falmouth is very, very nice.
But as the years passed, Maria found hardship once again, trying to care for her sprawling property.
I was slowing down. I always would say it's because of my age. This spring, when I was doing spring cleaning, I noticed that I was getting short of breath.
So this is actually the valve deployment of what we saw with Ms. Stevens' case.
A trip to her primary care doctor led to a diagnosis.
And he said, you got a problem with your heart, and you got a heart valve. And he was telling me, what if I don't do something about it, I will be a very short time in a nursing home.
Thankfully, Maria was a good candidate for the TAVR procedure, a minimally invasive aortic valve replacement.
So we have utilized this procedure to treat aortic stenosis patients from the entire Munson family of hospitals, from as far as the eastern UP to south of Cadillac to the Alpena direction. We've treated patients really from all of the satellite hospitals that Munson's affiliated with.
And while patients like Maria have their surgery at Munson Medical Center in Traverse City, much of their pre- and post-op care can be done closer to home.
The prime population to talk about this is an elderly group that has travel mobility issues. They have to rely on either themselves, children, bringing them different ways to get to Traverse City. So it can be tough. So if you can do things closer to home, such as the testing, such as the pre-procedural visits, post-procedural follow-up, the more that you can do closer to home, I think is way better.
Maria made it through the surgery with flying colors.
I was up 5 hours after the surgery. I was up walking the hall. And 3 days later, I went home. All by myself, doing everything by myself.
And today, she's still getting things done, feeling better than ever, and appreciating all that life has given her.
I am so comfortable here. If you want to work and you want to get ahead, you can do it.
For MedWatch, I'm Michelle Dunaway.